Recording now.
This meeting is being recorded.
Good morning, everyone. Welcome to the Hindu Physicians International webinar series. My name is Dr. Adityanji. Hindu Physicians International, our mantra or motto is Sharira Madhyam Khalu Dharma Sadhanam. Basically, body is the temple for us to take care of, whether it is our patient's body or our own bodies. In our zeal to take care of patients, we don't want our physician friends to neglect their own bodies. Just for record, today is Sunday, March 8, 2026. It is 10 a.m. Eastern Standard Time in US and 7:30 p.m. in India. And our distinguished speaker today is Dr. Lalit M. Parashar. And the topic of today's lecture is going to be rhinoplasty in Sushruta Samhita, Origins of Plastic Surgery. So a little bit about HPI. We are a faith-based charity by physicians of dharmic origin, and our aim is to serve the entire humanity. We have a self-governing board of directors with 5 members. We are registered as a non-profit organization in the state of New York in the US. So basically, we want to invoke the dharmic concepts into charitable medical activities, invoking things like Vasudhaiva Kutumbakam, Naraseva, Narayan Seva, etc., etc. Because we feel that there are multitude of faith-based medical charity organizations that provide humanitarian service and disaster relief, but those are based on their set of objectives. We hardly have any Hindu organizations or physicians that do under a Hindu banner. So we decided to start this physicians organization, Hindu Physician International. So this slide gives you the name of the board of directors, and we have a executive committee also, and the executive committee has, this is basically International Advisory Committee. Members of International Advisory Committee are chosen based on their excellence in the field, but they do not make any day-to-day decisions. We just take their guidance. And this is the executive committee. And our latest young physician to join the executive committee is Dr. Deepali Desai. She's director of outreach to Dharma organizations on behalf of HPI. Our objectives are doing community seva activities worldwide, develop rapid response medical teams, provide HADR or humanitarian assistance and disaster relief, promote prevention, research, and treatment for common illnesses, and assist in availability of clean water and prevent environmental degradation. So membership is free. You can go on to our website, fill up the membership form, whether you're a medical student, resident, consultant, professor, whatever. And membership is open to allied professions also. And there's a community seva project form that also, if you are doing any seva project locally, we encourage you to register that on the website. So some of you may have seen this flyer that shows our distinguished speaker today, Dr. L.M. Parashar. Dr. Parashar is MS in ENT. He is a Senior Consultant ENT Surgeon at Apollo Spectra Hospital, also at Pushpawati Singhania Research Institute and Asian Institute of Medical Sciences. He is involved in a number of volunteer, charitable, and philanthropic activities in the Delhi NCT region, National Capital Territory region. Very proud to say that he comes from the same high school or higher secondary school as I come, and he trained at Maulana Azad Medical College. So before I hand over to him, I will go over a couple of charitable seva project that we did. One was this Cleveland Food Bank Seva project. We sponsored 12,000 meals to needy families. And these are some of the pictures from that. And then we also did, some charitable work at Gathering Place, which is like a cancer rehab charity in Westlake, Ohio. They support women and children who are undergoing chemotherapy, require rehab. And this shows you, the women who are undergoing chemotherapy lose their hair. So these are the wigs and all. So we do activities like this. My request to all our members is, please, if you are based in US, please donate and support HPI. And you can, pay by PayPal or mail a check or something like that. The details are on the website. And let's start with the lecture per se from Dr. Lalit Parashar. Dr. Parashar, the platform is yours. Kindly you take over and start with your PowerPoint.
Namaskar. Thank you, sir. Thanks for a very good praise of me and mine. Yes, we are proud that we are from the same institution as you are in the high school level, that is Shaktinagar School. And of course, coming back to the present, I would request my slides to be shared, please, so that I can go on to see the thing.
Lalit, you are the host now. You should be able to share.
Okay.
Yeah, we can see.
Seem to be working all right.
Yeah.
Just let me get hold of cursor. I think I have to escape and get the cursor first out. Small problems initially. Yes, here we should be able to move. So here we go. Starting with the rhinoplasty in Sushruta Samhita. Dr. Adityanji tasked me to take this lecture today, and of course, my introduction. So, in today's days and world, this is the best rhinoplastic technique for any loss of skin on the tip of the nose or in the areas adjacent, that is the vestibule of the nose. These loss of skin sometimes cannot be filled by moving the local flaps, so one has to have some skin coming from somewhere else. And here comes in the forehead flap technique, that you take skin from the forehead, fold it onto this area, and stitch it with a starch, and it stays for some time. And after that, you can take the starch away. The original wound gets stitched, and you also have a good, beautiful looking nose. This is in the modern books of plastic surgery and ENT, that forehead flap is designed by using exact template of the defect, which is fashioned from the foil suture pocket, that is the clean suture, clean paper we have in the OT table, and we accurately measure the three-dimensional form and then fold it and blah blah, and we are able to do the thing. So this is diagrammatically shown that this is a flap we pick up, which is based on the superior trochanteric artery. So this area gets the blood flow, and this flap can be molded, can be brought in here, and we can refashion the nose, which is chipped in any way. And these are the arterial supplies where we can base the flaps. And you see the final results are quite gratifying. The patient doesn't show much scars and plastic surgery in the hands of plastic surgeons. This thing actually becomes very good. Plastic surgery, as we know today, sits at the pinnacle of modern day surgery because it involves best of the knowledge of anatomical anatomy and insights, best anesthetic techniques, best of the implants, best of the surgical skills and modeling, and best of the aftercare, because it aims to deliver best outcomes safely and predictably. But as this report was circulated on the WhatsApp, and Dr. Adityanji also sent it, that there was one there was Maratha truck driver, as we call bullock cart driver, in 1794. He was driving for Tipu Sultan forces and British soldiers, and his nose was cut off because it was found out by the Tipu Sultan. So Tipu Sultan, as we know, was a very cruel person. So he cut out the nose of the person to spite him, and this was a common punishment in those days. But Kosaji did not allow the British doctors to treat him. Rather, he advised them to take him to Mr. Kumar, Now, all this while, it was about 1 year that he came to Mr. Kumar, who was actually a brick kiln worker. This Mr. Kumar got the skin from the forehead of the Kosaji's forehead and stitched it back to the nose, and forehead skin also grew back. For the British doctor who was seeing all this miracle, it seemed to be actually miracle for him. So he drew the diagram and sent it over to British. It was published in the Madras Gazette as well as picked up from there by the Gentleman's Magazine in London. And this account was seen by other people besides this Dr. Constantine Carpio. He came to India, studied all this technique, and went back to US, UK, and he did two plastic surgeries of the same kind, chopped nose. He reconstructed using this plastic surgery technique. So this was known as the Indian technique that time. By all accounts, it was about 2,005-year-old back surgery. It was mentioned in the Sushruta Samhita, and this plastic surgery technique is still known as the method of plastic surgery by Sushruta or Indian. Now you see, these are the books of Sushruta Samhita. If I am visible, I can show it. These are the three. I think you can tell me I am visible. These are the three books of Sushruta Samhita, a voluminous account of surgical field. It is available. So it is recorded that a leaf of the creeper that time available 2005 years long years back, long and broad enough to fully cover the whole of the severe clipped part of the nose, should be gathered. Patch of living flesh equal in dimension to the preceding leaf should be sliced off from the forehead from down upwards in the region of the cheek or forehead, and this can be attached and made into a good looking nose. This is how the palm leaves of actual manuscript of the Sushruta Samhita was found. It is still in display in the museum in Nepal. This is how the English translation was made that time. And let me just recount that this is how we must have performed the surgeries. And we go on to understand what Sushrut was doing in that era, 2005 years back, 2,500 years back, that he was using anesthesia at that time, which was unheard of concept that time. He was measuring the properly assessment of the flap, harvesting the skin from the forehead or cheek, twisting the skin so that the skin is on the outside, prepare the nasal stump, carefully position the skin flap, suture the skin flap properly, insert hollow tubes so that patency of the nares is maintained, and post-operative care is again very greatly described. So this method is available in Sushruta Samhita, and we actually marvel at how long back our people were so far advanced. In those days, nasal mutilation was a common form of punishment for any crime like adultery, or in other case like Tipu Sultan. Sushruta rhinoplasty technique provided means of individuals to restore their appearance and social standing. This was very important because restoration of social standing was very important. For nose was very important part of that. Now we see over the years the advances. We know the Sushruta Samhita flap we have talked about, but the next major advancement comes only 2000 years after that, which is about 16th century, that they were using some kind of autograft in Europe. Late 19th century, we had the closed rhinoplasty techniques developed in Germany. Then earlier 20th century, open rhinoplasty was started in USA, and to this day these are things. So main thing to note is that about 2000 years we had this much of a lead in the curve as far as the knowledge was concerned. Somehow, because of our history, we lost so much of it down the drain. But now the whole world acknowledges that whole of plastic surgery in Europe took a new flight when these cunning devices of Indian workmen became known to us. This is one Dr. Hirschberg from Berlin, Germany. He had to acknowledge grudgingly, maybe. The ancient Indian surgeons performed nose jobs and skin graft is a well-known fact now, and therefore they consider Acharya Sushruta to be the father of plastic surgery. He treated numerous cases of not only the nose, that is rhinoplasty, also the lips as well as the ear, the Karan Sandhan and the Host Sandhan, and utilization of skin grafting techniques elsewhere in the body also. Even today, this rhinoplasty is known to be originating in those eras. Also, the Western world had to acknowledge that they say that the most of the knowledge which they are indebted to Greeks, the whole of Europe is indebted to Greeks. Greeks actually got it from the Egyptians, and Egyptians in turn obtained much of their knowledge from some mysterious nations of the East, that is us. Also, it is acknowledged that Indians are one of the oldest civilized people on the earth. Apparently, it was they who kindled the light of science for the world. This is acknowledged by Dr. Hermann Schelms in 1904. Difficult name, but yes, that is the fact. So coming back to this, our knowledge system, we are basically the Sanatan Dharma people, Hindus, believing in four Vedas. Our knowledge and wisdom is based on the Vedas. Apart from the four Vedas, Ayurveda is considered to be the fifth Indian Ved, and it is classical medical system of India. We are indebted to Acharya Charak and Acharya Charak Samhita for Charak Samhita. Also, Acharya Atreya and Acharya Agnivesh were again pioneers in those fields, and Charak Samhita remains a standard textbook 2000 years or more. It was also followed by Sushruta about 200 years later in 600 BC. Charak Samhita, Sushruta Samhita, and Ashtang Sangraha. These are the three main pillars of Ayurveda. First two deal with the medical knowledge, and Sushruta Samhita deals with the Shalya Chikitsa or the surgical knowledge. The core principle of Ayurveda is Swasthasya Swasthya Rakshanam Aturyasya Vikara Parasham. So this is the kind of shloks which have gone with the Shruti Smriti method over the centuries. Even when he lost most of the manuscripts, this oral hearing and memorizing this has protected our knowledge, and this protection of health and health is cured by disease. Over the period of time, this shlokas have kept our knowledge pool alive. Also, this system believes that health is maintained through balance of the Vat, Pitta, and Kapha. The three branches, as we said, are Kaya Chikitsa, Shalya Chikitsa, and Rasayan. Today, we are dwelling more on the Shalya Chikitsa. This is a very path-breaking slide. It is I owed to Acharya Sushruta. There are so many things which we can work out in detail. He mastered the anatomy through the cadaver dissection, which was an unheard thing in those days. He had groundbreaking surgical innovations like nasal rhinoplasty and advanced cataract surgery even. He designed over 120 kind of surgical instruments, giving details of not only making but also caring for the instruments. He championed the cause of cleanliness and sterilization, the fumigation and the cleanliness of the area and instruments. Also, he developed the concept of simulation of surgeries by various means. We'll be taking these things in detail one by one. So remember, Maharishi Sushruta lived in the ghats of Varanasi, that is Kashi, Banaras we call it today. This is a city which has a continuous living history of about 4,000 years or more. So this is one of the only 3 or 4 cities in the world which have this long a history. This Acharya Sushruta is credited with the first recorded description of rhinoplasty and over 300 other surgical procedures. Sushruta Samhita is the foundational Ayurvedic treatise documenting 1,120 illnesses, which speaks a lot for his acute observations. He has also documented about 700 medicinal plants. Alongside Charak and Vag Bhatta, Sushruta is regarded as one of the 3 foundational pillars of Ayurvedic medicine. His renowned textbook, his text, Sushruta Samhita, extends beyond the surgical practice, because a good surgeon is not only the one who does the surgery, but is the one who prevents unnecessary surgery and gets the patient to heal with other means. So the holistic healing, internal medicine, nutrition, and lifestyle guidance form part of the Sushruta Samhita. He emphasized that true health arises from balance state of the body, mind, and environment. We again are dealing with these aspects even today. Philosophy reflects deep understanding on the wellness that goes beyond treating symptoms. By integrating surgery into a broader framework of Ayurvedic healing, Sushruta firmly established that his legacy as father of the surgery, not only father of plastic surgery, but he was a father of surgery and visionary whose approach continues to influence even today. We'll see over a course of slides. So Acharya Sushruta, as we know, was a teacher of medicine at Banaras University at the Ghats of Banaras. He established original code of medical ethics, which I wish people of today, the surgeons as well as the physician, go through. The medical ethics, he said medical practice has to be very ethical, and this is the need of the hour even today. Secondly, he emphasized the importance of comprehensive physical examination. As we all know, using all senses and encouraging his medical students to adopt a very thorough approach other than the casual approach to medicine and believing in some higher superpower or gods. He had remarkable insights into the pathogenesis of the diseases. described, as we said, 1,120 specific disease entities and showcases deep understanding of various medical conditions. He was the first one to attribute malaria to mosquitoes and spread of plague to rats. So these are path-breaking things, as we say, if we think that these are about 2,500-year-old things. He also dwelled on the diabetes and also advised tasting the urine to understand what is happening. So it is a sweet sense to urine, and he could know that. Sushruta performed surgery and instructed students of university remained preserved for many centuries exclusively. Let's go to the history, how it came to us. So it was initially a Sanskrit language only, which was transmitted orally, oral Shruti and Smaran traditions. In the 8th century, when the trades between India and the Europe and at least the rest of the Asia started, Sushruta Samhita got translated into Arabic as Kitab Shah Sun Hindi, as well as Kitab-i Susud. Latin translation was later, and the Arabian translation served as the basis for the Latin translation. In 1823, Wilson published an essay on the importance of medical and surgical science of Hindus. First European translation of Sushruta Samhita was published by Hessler in Latin in 1844 and German in 1846. I think that landmark case of Kosaji and his nose was proved very important, and therefore people had started having interest in our Indian things. And eventually the English translation was published by Kaviraj Kunjalal Bhashi Gharatna, which I just showed you the 3 books in 1907 in Calcutta. So you can see how voluminous the whole thing is. It is in Sushruta Samhita is composed in 6 sections. That is, they are called sthanas. Further, every section is composed of multiple chapters, which are called adhyayas. Total of 186 adhyayas. You can see the comprehensive knowledge of medicine being transmitted here. So 6 adhyayas were Sutra Sthan, Nidra Sthan, Nidana Sthan, Sharira Sthan, Chikitsa Sthan, Kalpa Sthan, and Utteriya Tantra. So many adhyayas in every aspect of this. So he showed his pupil various techniques and how to go about it, apart from the basic knowledge of disease. It talks about broad principles of surgical surgery. It teaches asepsis to the teachers, to the pupils, such as necessity of cleanliness, sterilization, and maintaining sanitized surgical environment. This was a path-breaking thing for that time, and it continued still today. Also looks into techniques, methods, and methods used in surgical procedures such as wound closure, suturing, bandaging. He showed it to his pupil using everyday things. He also gave the qualities of ideal surgeon. Ideal surgeon in those days called Vaidya, who had to possess 8 key physical and mental attributes: bravery, speed, skillful hands, non-sweating hands, non-trembling, proficiency in instruments, self-confidence, and a sound knowledge of theory. They should also be compassionate, ethical, and maintain very high personal cleanliness. So should emphasize the understanding of anatomy to a very great extent. He advised using dissection of human cadavers, which we all start our anatomy with nowadays. It is so commonplace, but those days it was against the codes of prevalent that time. Manu was against this mutilating the human body in any way, but for the pupil, it was seen to be approach to cadaver dissection was unique. They had to understand the body to be able to do any kind of surgery. He primarily focused on dissecting the bodies of infants under the age of 2, because elder people were generally cremated and those corpses were not available. So they used corpses of children under infants, and generally they were put into the river Ganges, and they could be controlled. Their flow could be controlled, and they could have some bodies available to them. Cadaver preparation was, it was wrapping them in the grass, submerging them in the river for about 7 days. The process facilitated decomposition of the tissues, enabling the study of structural details of human body. And you see, the whole Western world thinks that Andreas Vesalius was the first person, the most famous figure in the history of cadaver dissection, and he is known as the founder of modern human anatomy. He was preceded about 2,000 years by Dr. Sushruta, Acharya Sushruta, and he was doing all this as a commonplace. Also, Sushruta emphasized hands-on practical approach to the surgical education. hands-on activities and teaching methods, and all these are described in great detail just to simulate surgeries. These methods include anatomical structure using carcasses of not only humans but animals, also vegetables to simulate the surgical procedure like suturing and puncturing. Incisions, for example, were practiced using vegetables like what we call petha, other things, and also evacuation processes on leather bags from water and urinary bladders of the dead animals. Scarification techniques involving superficial cutting was performed using animal hides. Vivisection, even they practice vivisection either from the vessels taken from the diseased animals or even water lilies. The art of stuffing and probing was also seen using bamboo reeds, and it demonstrated how to extract solid objects from the foreign bodies from the body using similar available objects. Scraping techniques were also practiced on tax, a type of resin, also on shamli wood, which is a softer wood. Similarly, suturing exercises were conducted on pieces of cloth, skin, and hides. These are some of the diagrammatic representation showing how to incise and how deep to go, the bandaging techniques, the cauterization, which was again a first. Even today, we are following the same methods. The methods might have changed that we are not using this hot iron, rather, we are using electrocautery or laser cautery or some other kind of thing. But the principle remains that we are using cauterization to control the bleeding. Sushruta basically planned about principal surgery as first starting with planning. It has to be precise. Hemostasis is a very important thing, and then perfection in using anesthetic agents. Anesthetic agent was actually one of the earliest. He was one of the earliest to use. Another first to his credit is Dr. Adityanji will be very happy to note that he was not only talking about physical well-being but also talking about mental health, and he brought about preservation of mental balance. Of course, he said about humors, balancing of humors, good nutrition, elimination of waste properly, and present contented state of mind and body. He also used his expertise in surgical education by combination of theoretical and practical knowledge, ligature and bandaging skills. He told his people catheterization. Also, he showed aid of simulated techniques like Sushruta trainees were able to gain practical knowledge. We have seen his quotation that theory without practice is like one winged bird which is incapable of flight. So he should detail about 101 blunt instruments and 20 sharp instruments. He called them Shastra and Yantra respectively. He emphasized that fine edge is required for their use and they have to be sterile. This was a very path-breaking knowledge of his. The tools have to be very high quality, metals like copper, iron, and gold. The tools have to be well cleaned, of the right size, have pointed edges, and made of strong materials, and have handles that are easy to use. So these are some of the instruments detailed in the Sushruta Samhita, and there is a whole chapter on this. They were either yantra or shastra, and he has described them in detail. The artist's impression of these things. Care of the instruments, especially tempering of the surgical instruments, were required using substances like caustic and alkalis, not only making them sterile but also more effective, water or oil. This tempering process was aimed to maintain them in good condition, preserve functionality, reduce the risk of contamination during surgery. Even today, we are using most of these procedures. Sushruta instructed to use aseptic procedures for operation rooms and recovery areas. He recommended sterilization using substances like salt, mustard, clarified butter, which can be considered one of the earliest forms of antiseptics. Of course, our methods might have changed, our chemicals for asepsis might have changed, but we are still using the theory of asepsis even today. His use of technique shows that he was aware of the detrimental impact of the germs and requirement of disinfection, which to this date we are saying. Another path-breaking idea of his was dhupana, or asepsis and dissemination, fumigation of the areas where we perform the surgeries. It is an Ayurvedic practice that uses plants that have antiviral and antibacterial qualities. Even today, the knowledge is coming to know that the fumigation actually improves the quality of one area. And earlier, Havan and Yagya were supposed to do the same. And modern science is again ratifying the same things in a different way. Though even today, the OT, if someone makes the OT bad, our sisters and OT staff fumigates the operation theaters. So we might have changed the chemicals. They were using gugul, vacha, white mustard, sandhawa, rock salt, and nimba tree leaves. We are using different chemicals, but the thing is same, that we fumigate the operating rooms, labor wards, post-operative wards. Sushruta, fumigation has demonstrated beneficial effects in eliminating airborne germs and disinfected inanimate objects. This shows there is significant potential even today for herbal and fumigation techniques in these eco-friendly areas, and we should be using them more and more. Now we come to the surgery proper. Sushruta also discusses several elements of patient care, including anesthesia, pain management, and problems which emerge after surgical operations. So these are path breaking. Going back, combining pain management was first actually all over the world in a documented way. Sushruta listed many soporific and alcoholic concoctions for the use of anesthesia in Sushruta Samhita, including henbane, which is Hyoscyamus niger, and Indian hemp, cannabis. These preparations were likely administered orally or topically, and of course they were using sedation. So also highlighted value of feeding the patient properly, the importance of feeding or keeping them empty stomach, depending on the case. So he recommended patient, so many patients had to be kept empty stomach, where we had to intervene in terms of parturition, ascites, piles, bladder stones, or anal fistula, and they started affecting oral cavity. Whereas other patients had to be well fed so that they were able to maintain their body and remain pain free during surgery. His comprehension of anesthesia and analgesia paved the door for many modern surgical procedures throughout his lifetime. Surgeons are able to progressively perform more difficult procedures and enhance patient outcomes using pain control strategies. He uses techniques that would be viewed as archaic by the modern standard, but yet they laid the ground. Basic principle was made by the Sushruta. He of course advised anatomy, the trauma care, the pharmacology, and then using this principle in surgery, orthopedic, gynae, plastic and reconstructive surgery, obstetric and eye cares. His use of anatomy, understanding of disease, surgical tools, steps of surgery, and care after surgery remains path breaking even today. His teaching covered 8 fundamental types of surgical procedures, which were extraction, excision, incision, probing, scarifying, suturing, puncturing, fluid evacuation. He has whole chapters devoted to this. Remarkably, these techniques were taught using household objects and materials such as showcasing Sushruta's resourcefulness in practical settings. He described 60 types of upkarma of treatment of wounds. He described 120 surgical instruments, 300 surgical procedures, classification of human surgeries in 8 categories, as we said. These in Hindi are Chedya, Lekhya, Vedya, Esya, Arya, Visarya, Sivya, and Sandhana. Also, in the realms of accidental injuries, he described all over the body 6 varieties of accidental injuries: Chin, Bhin, Vidh, Pran, Kshata, Pichita, Grishta. He was pioneer in complicated surgeries, and he described in detail the cesarean section, the cataract, the artificial limb, the fractures, the urinary stones, the plastic surgery, and not only described the main surgical steps, he described the pre-operative care, Purv Karma. He described the per-operative detailed surgical steps, how to go about the surgery, and even described the post-operative treatment, which is called Paschat Karma. He also detailed about complications which might occur after best of the surgeries and how to manage those. For example, let's take the rhinoplasty described earlier. He had described in detail how the hypopigmentation resulting in the nose looking different from the rest of the body, how to tackle this, the Krishna karma, the hyperpigmentation if it occurs, how to take care of this. If there is repoilation of that is hair, extra hair on the area of the nose, how to tackle that, and how, if there is depilation of the areas where the hair are required, how to go about it. So he has taken everything in detail, and therefore Ayurveda is considered as part of the Atharva Ved. The global legacy of Sushruta Samhita is that his knowledge of principles of anatomy, surgical precision, patient care it was predated Western century by the centuries at more than 2000 years. His meticulous approach remains relevant even today, bridging the ancient wisdom with the modern surgical science. We can just infer that if India was not looted or India was not plundered and our manuscripts are not burnt like this, we would have had a wealth of knowledge and we were so far ahead of the curve to begin with. But somehow our strange history took all the knowledge away, and whatever is left is only the translations available to us through the various travelers, and therefore so much would have been lost in the translation. As we know, it was translated into Arabic, and then 1794 revelations in the report in the Gentleman's Magazine, as we have described, and modern day Indian forehead flap remains fundamental technique even today. Sushrut's lasting influence, we can recap, is on the medical profession across the world. We study Sushrut's work in detail and for the depth of procedure. First surgery for use of herbal anesthesia, his work shows medicine was far more advanced than previously thought, and increasingly people realizing that and acknowledging our contribution to in these fields of plastic surgery, orthopedic care, general surgery, surgical education, and ethics. His contributions have been acknowledged by the global medical community, and we are often included in the medical textbooks now, and people can study these and actually come to their own conclusions. Especially lasting influences are example is anorectal disease. Even today, the Ayurveda Charya is using Kshar Sutra. These are for any outpouching of the body, any pedunculated growth can be taken care of by medicated thread tied across, like they can do in the piles, hemorrhoids, in the small growths of the skin. So these threads, and eventually the tissue lies off and skin becomes healed. Similar in the ophthalmic surgery, Sushit attributed out towards glory of discovering the art of cataract surgery, crouching, which was unknown to the surgeons in ancient Greek and Egypt. Amputations were freely made in ancient India. Sushruta does not rest content on mere busting out, opening of abscesses. Healing of the wounds incidentally and lays down the process for major operations as well as removal of cicatrices, that is the post-surgical complications. It becomes the same color and surrounding skin should be having same growth of hair. These are the areas where he tackles the post-operative complications. In obstetrics and practical midwifery, different turning and flexion techniques, gliding movements of the abdomen, also application of forceps, as well as other obstetric operations involving destruction and mutilation of the child involved in Samhita, and such as craniotomy and the forceps in case of difficult labor. Mentioned are fumigation and sterilization techniques we owe to Sushrit only. And this is just a small account. His Samhita, each chapter you read and you come to know that it was such a vast area of knowledge which has been unexplored till now. And we should be, our surgeon friends should be going more and more into it. But what should be music to the ears of our surgery friends is that he said the Sushrut utilized the surgery as the first and the foremost branch of medicine. He said surgery has superior advantage of producing instantaneous effects by means of surgical instruments and appliances. Hence, surgery brings highest value to all medical tantras. It is the eternal source of infinite piety. It imports fame to the person imparting it. It opens the gates of heaven to its votaries and prolonged duration of human existence on earth, and also helps humans in successfully completing their mission and wearing a decent and competent life. These are the original manuscripts somehow brought together. One of the oldest known palm leaf manuscript is available in Kaisar Library in Nepal. This is Acharya Dhanvantri, in whose honor we still observe the Dhanteras. It is for health, and he is the god of health. And Sushrut also invoked him. And this is the statue of Acharya Sushrut at the Amrita Medical Institute, Kochi. Thank you, sir. With these words, I take leave. Thank you.
Thank you very much indeed, Dr. Parashar. I think you rightly, finished with the statue of Acharya Sushrut. For our audience, there is a similar statue or bust of Acharya Sushruta at the, entrance of Royal Australian Colleges of Physicians and Surgeons. And I think some of you have seen because I had circulated in some of the groups. So, point that is being made that medical sciences, what we call as modern medicine, are not divorced from Ayurveda. Ayurveda is the mother or father of all modern medicine. There's a continuity in evidence-based research, and we see that Acharya Sushruta was basically father of surgery, whether plastic surgery or any kind of surgery. The story that you talked about, rhinoplasty, with this driver, it generated a lot of skepticism the way it was presented because of the use of word truck. A truck is a motorized vehicle, but even before the motorized vehicles became available, there were wagons that were used to transport the supplies during war. So
Madras Gazette actually tells bullock cart.
yeah, it's a bullock cart actually, which is a kind of wagon. The other thing was that the name of the person who was the bullock cart driver that was wrongly written, it's basically a Parsi name, Kaus, Cowasjee. So there were a couple of things there that people were a little bit skeptical without realizing that there's a treasure trove of knowledge, and time has come that we have to acknowledge our own roots and our achievements. We don't have to just bask in the past glory, but at least start with self-confidence that yes, we had a system of evidence-based knowledge and research. So we have some time, and we are a small group today because of various things. So anyone who wants to ask a question, I think you turn your video on and please ask the question to Dr. Parashar, and I'm pretty sure you will have a fruitful discussion with him. So if anyone wants to ask a question, kindly unmute yourself and turn on your video. I'm not going to moderate because we are a very small group.
Thank you, Dr. Parashar, for a wonderful lecture. I was not aware of many of the things that you mentioned, and I feel that more and more of such things should be brought in general public, and it should come from physicians and scientists. So, apart from Sushruta, there were many other such scientists and physicians. And what can the medical community do to bring more of that knowledge in general public so that like our society has a sense of pride for our ancestors?
Sir, first of all, we medical people have to be more presentable to amenable to this idea that apart from our allopathic sciences which we have studied, we should not be having unnecessary ego about it. There are so many other systems of relief giving which we keep on using. Our nannies and homemade remedies used to be available to us in childhood. Somehow over a period of time, these have been going away in favor of Western pharmaceutical based things. So something like mulethi, elaichi, saunf, mishri, these for the sore throat, I keep telling my patients that please use these things liberally. Similarly, so many other things like good smelling things, they enhance the quality of life. They improve your emotions and well-being. Dr. Adityanji will bear me out that all these things, fragrances can bring out good mental state also. Similar is the thing with the music. The mantrochar is known to cause streamlining of things as we see on a piece of cloth, taut cloth. If we spread the powder and play some music, it arranges into the beautiful patterns. So all these chantings and all these sounds have some effect on all our systems. Only thing is, science doesn't know. Present day science maybe doesn't know anything which we investigate. We come to ratify what our ancestors were actually telling us all these years. The case to point was use of animal based or plant based vegetable oils. The whole generation of our generation has paid to our heart attacks because too much of emphasis was made on the things. So what I say is we have as the scientific people, we should not be close to the idea of something which else can be equally good. Today's science has proved to be so wrong in so many things over the years that later on we retract our studies. So it is better to be open-minded towards anything. Maybe there are other systems like homeopathy, like Ayurveda, Unani, Tibba, whatever. So we should be open to the good ideas from everywhere, because ultimate goal is patient care, whichever we can deliver that. So in that line, we should not only not brush aside whatever is being suggested, but also explore on our own levels what are the good things coming from other systems, and maybe inculcate them in our day-to-day practice. In ENT, I find the scope quite a lot. A simple fact is, but I think most of people can understand Hindi. भुने हुए चने की कोई भी चीज खाओ तो आपका गला जल्दी ठीक हो जाता है. वो बेसन का शीरा खा लो, ब्रेड पकौड़ा खा लो, तो गला जल्दी ठीक हो जाता है. I mean, it's such a simple thing to follow. It is not going to harm the patient, and if at all, it will be good for the throat. So similar thing, we have to be open-minded towards other pathies, other scientific things, and of course, we don't have to lose our scientific tantrum, the scientific temper. Our all systems are scientific only. Vedas are full of science. It is not for nothing that any new discovery comes, we already have a word for it, whether it is Chumbak, whether it is Vidyut, whether it is Anu, whether it is Parmanu, we already had the words for any kind of things.
Thank you.
Anyone else has a question? Please unmute yourself.
Dr.
And
Lakshmi, I think, asked something. I just missed the.
she wants your contact details.
Yeah.
Well, I am not an
Namaste,
Ayurvedic
everyone.
doctor. I am a ENT doctor, actually, madam. So I don't have much knowledge about Ayurveda as such, except that what I have read Sushruta Samhita for this talk, and I was greatly impressed. I will be going through all the chapters in detail now in times to come. I mean,
Thank you so much. This was very enlightening. I am also an orthodontist, but I am part of a conveyor for New England for GIST. We want to bring in our ancient systems like,
True, very true,
Ayurveda
very
into the food and everything here, because most of our children, the way they are eating and the lifestyle in US is like, I see so much childhood obesity. So we want to bring some awareness towards our eating habits and living habits here.
Yes, ma'am.
So I would really like to collaborate with you and see how we can work this together. If you
Sure,
don't
ma'am.
mind
We should all
helping
be
me.
at HPI and work together for all this. Yes.
Sure.
Dr.
But
Lakshmi, I will share Dr. Parashar's contact details with you later on.
Thank you so much. Thank you so much. Very nice initiative. Thank you.
Anyone else who has a question? I see
I would
Dr.
like
Kishore.
to congratulate Dr. Lalit ji for a wonderful lecture. सर बहुत बहुत नमस्कार आपको. सर बहुत बढ़िया आपने आज हमारा सुश्रुत पे दिया है. सुश्रुत का एक वर्ड ये है कि बड़े ध्यान से सुनिए, मतलब अगर उसे संस्कृत में हम विभाजित करें तो आपका जो भी लेक्चर में मतलब बिल्कुल वर्ड टू वर्ड टू द बहुत ही प्रिसीजन रहा, जैसे हमारा सर्जरी प्रिसीजन होती है. सेकेंडली आई विल टेल वन थिंग, नासा शीर्षोद्वारम जो हमारे आयुर्वेद में बताया कि नोज इज द पाथवे टू द ब्रेन. अभी जो ब्रेन की सर्जरीज भी अभी रिसेंटली रोबोटिक सर्जरीज पीछे शुरू हुई हैं थ्रू द नोज की.
मैं कर रहा हूँ सर. आई एम डूइंग इट.
ओके सर, वेरी गुड. तो ये सर हमारा मतलब पूरा आपने बिल्कुल कॉन्सेप्चुअल सारी चीजें कवर कर दी हैं, बहुत बढ़िया लगा. थैंक यू वेरी मच.
डॉक्टर किशोर, आपकी बात को आगे बढ़ाते हुए आई वुड लाइक टू से that unless we are breathing through the nose, we don't feel awake.
Sure.
In the Ayurveda and in Yoga, this thing is very emphasized in a great detail that you breathe from the nose, right side, left side. So it
Yes.
is actually modern science that unless the base of skull is getting the air flow, you don't feel awake. You are not as alert and awake to the atmosphere as it is. The people with the nose blocked generally have lower IQ levels. It is a well-known fact. People, you call them adenoid faces or you call them idiotic faces because they are breathing from the mouth and not breathing from the nose, and things look bad.
Yeah, there are 4 studies we tell Turiya Avastha, these 4 avasthas, na? These are actually psychosomatic also. Means actually Ayurveda goes into all the spaces.
So you are the expert, sir. You are the expert.
Sir, thank you.
So anyone else who has question, because we do have time, just unmute yourself and please ask question to Dr. Parashar. We have few minutes for the question and answers. Doesn't look like anyone has questions, so I'll make a few comments. One is that we are doing these webinars every 2 weeks. If any of the physicians or surgeons or Vaidyas, anyone is interested, I am willing to bring you on the platform on a particular topic of relevance to you. Please don't hesitate to contact me. We have done actually lectures and webinars on Ayurveda and etc. So we are not, restrictive in any manner. We keep an open mind, and I would like all of you to keep an open mind. My second request is that as physicians of dharmic origin, we need to make our presence known in the community. Wherever we are, most of our physicians and surgeons are doing charitable work, but that is being done on secular platforms. Unfortunately, even Indian physicians organizations in the US tend to use secular platforms, although majority of the membership is dharmic, whether that is Sanatani or Jain or Buddhist or belonging to Sikh Panth. We need to show our cultural, our philosophical heritage in our charitable work. So I want you to use the platform of Hindu Physicians International rather than using Red Cross or Médecins Sans Frontières, Doctors Without Borders, etc., etc. There are a lot of faith-based charities. You should not have any inhibition, any shame, any embarrassment using a faith-based platform of Hindu Physicians International. And I see Dr. Lakshmi has raised her hand. So, Dr. Lakshmi, please go ahead and say whatever you have to say.
Thank you so much for the opportunity. Since I'm a dentist and an orthodontist, and ENT is very close, I see a lot of people with mouth breathing. They are not able to, the size of the tongue is very big. Is there anything where Sushruta had done, like related to that, like expansion of the jaw or anything like that? I was just curious to
Not
see.
that advanced because baby anesthesia had limitations that time. He could not have
Mm,
taken procedures because it requires safety of the patient first. He was relying more on his Schwas, of course, he had a whole chapter to Schwas, but he was relying more on the concoctions to open the nasal cavity somehow, and that included liquors like tea. Tea was not available, but whatever else they could find so that things open up. As I was saying about the bhune hue chane, similar thing is in the some drops you can put in the nose like eucalyptus oil, etc. These find a
mm,
mention. He had actually got hold of about 700 medicinal remedies. So he was not only a surgeon, he was basically a complete Vaidya trying to treat the patient in whichever way possible. And surgery was another extension of the same. It is not that he was qualified surgeon only. He had innovation during in the surgery, which was an extension of his where they work only.
very nice.
So I had
Dhanyavad.
mentioned the the bust or the statue of Acharya Sushruta at the Royal Australian College of Surgeons, and I requested Dr. Vikas Jain to put up this slide. Actually, it shows, and it titled Sushruta whatever BCE, Father of Surgery.
Yes,
So
Mm,
very true, very true.
unfortunately, when our own past achievements are recognized in the West, ideological West, we then fall for it. But if anyone else talks about the achievements of Indian science, Indian medical sciences in the past, we say it is all myth. It is
mm.
just, some stories. But now we have the opportunity.
Colonization.
Agree, agree.
Now,
That is the
Yeah.
crux of the matter.
yeah, now we have
Mm.
opportunity to revisit these issues with an open mind and study these accounts in a scientific manner. So let's not be diffident about our past achievements. Yes, we cannot rest on those past laurels. And yes, Indian physicians are everywhere, all over the world, doing excellent work. But we do need to take pride in our past and not just trivialize that as mythology or some stories or things like that. So, since there are no questions, without further ado, I thank profusely Dr. Lalit Parashar, who made this lecture very interesting. And I hope that he spearheads this information into medical education system at MBBS level, so that, when they are learning about surgery, they need to know all this thing, so that they, when they become professionals in their future life, they take pride in it and continue the same tradition. And again, I am requesting our audience members, please get in touch with me if you want to make a presentation. Does not matter what topic in medical sciences. We are open to every topic as long as we have an evidence basis. So we will be coming back in 2 weeks' time on this particular platform. And now we are ending the meeting. Thank you very much indeed.
Thank you.
Thank you.